Hello everyone, my name is Sarah Benites and I'm a junior here at Anna Maria College. I chose to focus on the pandemic's effect on domestic violence as it incorporates both my majors and I deem it to be a very pressing issue in which action needs to be taken. I hope you enjoy my presentation. According to the Centers for Disease Control and Prevention, intimate partner violence is described as physical violence, sexual violence, stalking, or psychological harm by a current or former partner or spouse. The United Nations describes 6 different types of abuse. Emotional abuse includes undermining one's self-worth through criticism, belittling, name-calling, and other forms of verbal abuse. Psychological abuse involves causing fear by intimidation, threatening physical harm to themselves, partner, or a loved one, destruction of pets or property, and forcing isolation from friends, family, school, and/or work. Financial or economic abuse involves making or attempting to make the partner entirely financially dependent on their abuser in order to maintain control. Physical abuse involves hurting or trying to hurt a partner by hitting, kicking, burning, grabbing, pinching, shoving, slapping, or other forms of physical force. Sexual abuse involves forcing a partner to take part in a sex act in which the partner does not consent. Stalking involves any pattern of behavior that serves no legitimate purpose and is intended to harass, annoy, or terrorize the victim. This is often not viewed as a form of intimate partner violence. However, it generally escalates to another form of abuse, such as physical abuse. Anyone can be a victim of domestic violence, no matter their age, race, gender, sexual orientation, faith, or class. There are believed to be some risk factors associated with the abuse. This includes being from a lower economic class, as well as having a partner that is addicted to drugs or alcohol. Unfortunately, intimate partner violence is not uncommon, as about 1 in 4 women experience IPV and about 1 in 10 men. 1 in 5 homicide victims are killed by an intimate partner, and 40 to 60% of murders of women in North America are committed by intimate partners. According to the American Psychiatric Association, 20% of IPV survivors report onset of psychiatric disorders as a direct result of their abusive situation. Women who experience IPV are likely to suffer from PTSD, depression, disassociation, a change in attitude or outlook on life, which may lead to them feeling hopeless, unmotivated, discouraged, and apprehensive about their future, make them feel constantly unsafe and uneasy. They may also suffer from substance abuse disorders. They are likely to blame themselves rather than their abuser for the situation, which then leads to feelings of anger and resentment towards themselves. Chronic abuse may lead to compulsive and obsessive behaviors, as well as self-destructive and suicidal tendencies. They may experience difficulties in new relationships due to their past abusive relationship. IPV has also shown to affect one's emotional regulation, facial interpretation, and reading of social cues. Studies found the risk for depression and post-traumatic stress disorder associated with IPV was even higher than that resulting from childhood sexual assault. A Canadian-based study found that women who had suffered from IPV had significantly more anxiety, insomnia, and social dysfunction than those who had not experienced IPV. Women in developing countries also reported mental health problems from abuse, with 70% of cases of emotional distress in Nicaragua attributed to intimate partner violence. IPV survivors have also been shown to have experienced physical health problems as a result of the abuse. According to the American Psychiatric Association, IPV survivors are more likely to experience higher rates of health problems and perceive their overall health as poor. The injuries, fear, and stress associated with the abuse can lead to chronic health problems, which include chronic pain, such as headaches or backaches, or recurring central nervous system symptoms including fainting and seizures. IPV survivors are also likely to develop a range of other conditions in which affect the heart, digestive system, and gynecological issues. Women who have suffered from an abusive relationship are significantly more likely to develop gastrointestinal symptoms. and be diagnosed with functional gastrointestinal disorders associated with chronic stress, and the damage to the bowel can last far longer than the abusive relationship itself. The stress of the relationship can also cause the immune system to be suppressed, leaving them vulnerable to other diseases. The most consistent and longest-lasting physical health difference between battered and non-battered women are gynecological problems. Studies conducted in the United States and developing countries have shown there is a link between IPV and sexually transmitted diseases such as HIV, as well as unplanned pregnancy, and pregnancy complications for both the mother and the child. 10 to 44% of abused women report incomplete strangulation as well as blows to the head resulting in loss of consciousness, which can then lead to serious medical problems such as traumatic brain injuries, which leads to both short-term and long-term neurological issues. Women are also likely to experience chronic fatigue, shortness of breath, muscle tension, involuntary shaking, changes in eating and sleeping patterns, sexual dysfunction, and issues with their menstrual cycle or fertility. During the pandemic, intimate partner violence has shown to have increased in the United States. The Portland Police Bureau has reported a 22% increase in arrests related to domestic violence compared to the weeks prior to the lockdown. The San Antonio Police Department noted they received an 18% increase in calls pertaining to family violence. In Jefferson County, Alabama, the sheriff's office reported there was a 27% increase in domestic violence calls in March of 2020 compared to March of 2019. New York City Police Department responded to a 10% increase in domestic violence calls compared to March of 2019. Publicly available crime data showed that by April 15th of 2020, aggravated domestic assaults were up 37% on the year and were 16% higher than all of 2019. A study conducted in the New Orleans community in order to determine the pandemic's effects on crime showed a 59% reported escalation of IPV among those who experienced IPV prior to the COVID-19 crisis. The increase in IPV as a result of the pandemic is not limited to just the United States, as other countries have shown similar data. Local police departments near the epicenter of the COVID-19 outbreak indicate that domestic violence tripled during February 2020 compared to February of 2019. France has also reported an increase in IPV since their March 17th lockdown, as they report intimate partner violence has increased by 30%. Argentina reports a 25% increase in domestic violence calls since the lockdown began on March 20th. Cyprus reports that a 30% increase in calls were made to the domestic violence helpline, and Singapore experienced a 33% increase in calls made to their domestic violence helpline. There has been a reported 40 to 50% rise in domestic violence cases in Brazil. The organization Refuge, in which is the leading domestic abuse organization in the UK, has reported that calls to the UK domestic violence helpline have increased by 25%, and in the 7 days following the announcement of the tighter social distancing protocols, there was an 150% increase of their website views. In affected countries, there have also been an apparent increase in domestic homicides during the COVID-19 pandemic. Much of this data was collected only a month after the lockdown procedures began, so it is likely that these statistics are now much higher. The policies put in place as a result of the pandemic has had a significant effect on victims of IPV. The isolation as a result of the stay-at-home orders may expose or worsen vulnerabilities, as there is a lack of established social support systems in place during this time. The stringent restrictions on movement also shut off avenues for victims to receive help. There has also been reports that abusers are misinforming their partners as a way to prevent them from seeking help or going to the hospital. They are also using the fear of contracting the virus or spreading the virus as a way to keep the victim in the home. Having their abuser home with them at all times has made it harder to seek help and made it harder for them to make phone calls in order to get help. Due to the closure of the courts, restraining orders are now even more difficult to obtain and renew, so the pandemic has led to an even more dangerous situation for those in an abusive environment or who have just escaped an abusive relationship. The financial stress associated with these policies have also likely increased the abuse that these women are experiencing at home. Many family and friends are not allowing these individuals to stay at their homes due to fear of contracting the virus, and it is far more difficult to find a vacancy at a domestic violence shelter during these times. Finding a domestic violence shelter with availability was nearly impossible prior to the pandemic, and the pandemic has caused greater issues in this area. The director of Mass General's Haven, which stands for Helping Abuse and Violence End Now, states shelters are even more limited than usual, and friends and family are less likely to share their homes due to coronavirus concerns. She reports that Haven is now receiving triple the number of referrals for new patients who need help with abusive relationships. Social distancing restrictions have led to a 50% reduction in the capacity of domestic violence shelters, which has led them to resort to temporarily housing victims in hotel rooms, but given the cost of this, it is unsustainable for these shelters that are already operating with minimal budgets. Prior to COVID-19, housing resources were already very limited, as mentioned before. A report by the National Network to End Domestic Violence shows that in just one single day in September, there were 11,336 requests for help that went unmet, which nearly 70% were requests for a safe place to stay. According to the representative of the YWCA, many of these women are having to choose between staying with their abusive partner to maintain a roof over their head or risking ending up homeless, as there are only 168 shelter beds in Massachusetts prior to the pandemic, and the social distancing restrictions has limited that number. A study has found that between 22% and 57% of homeless women report that domestic violence directly led to their homelessness. A representative of the Hope House, which is a shelter in Kansas City, Missouri for battered women, states that the shelter usually houses 122 people, but due to the social distancing restrictions, they are limited to just 6 families at each location. She also states that they don't have enough money to help people get to the next step in housing, which means that they have to stay in the shelter longer, which then leads to another individual who needs shelter that can't access it. Many domestic violence programs are also in danger of losing donor funding due to the coronavirus's impact on the financial resources of families and organizations. It is important to ask these individuals questions to see if they feel safe at home and to listen and look for signs of abuse. It is also essential to keep services available to them during this time, such as telehealth, as well as other services, as some individuals may not be able to access telehealth at home due to the inability to afford the resources needed to access it, or because of their abusers' control tactics. It is important to be emotionally supportive to these individuals and offer help, but also understand the goal is not to get them to disclose their situation to you or to help them leave if they do not want to leave the situation. Finding new, discreet solutions are also imperative to help these victims. Some countries have implemented silent and safe services in which victims can go to essential businesses such as supermarkets and use a code word to signal an urgent request for protection from their abuser. Having a safety plan in place for these individuals is essential. These plans can include knowing the location of the local police department, having important documents hidden in a place that is easily accessible for a quick exit, and developing signs to communicate with individuals such as a neighbor that they should call 911 through signals such as putting all the shades down in the home. I was able to connect with a representative of the YWCA, who stated that the program went remote, which actually allowed for more individuals to access such programs as they did not have to worry about barriers such as childcare and transportation. She also stated that the majority of individuals who contact the program are looking for a safety plan rather than a way to leave the abusive relationship at that moment. Unfortunately, courthouses have not been allowing a lot of their safety plan advocates to enter the courthouses due to COVID restrictions, which is out of their control but has created great barriers for participants. She states that it's important to believe the individuals and not to give up on them, as well as to remain patient, as it is not always in the individual's best interest to immediately leave that relationship, nor is it always the safest option, given that the first 6 months after leaving are the most dangerous. It generally takes a woman an average of 7 times in leaving the relationship before it's finally successful. It states that it is also important not to make the individual feel as though they're isolated or to badmouth their partners. It is also beneficial to let them know about resources such as the YWCA and ultimately just be as supportive as possible. The YWCA plans on continuing remote services even if they are able to go back in person, as it is proved to be incredibly beneficial in getting rid of those barriers. If you or someone you know is in an abusive relationship, here are some available resources. Listed here are the references used for this presentation. This concludes my presentation. I hope you found it informative.